Good evening and welcome to Hearts and Hills. I am excited that you are joining us tonight. I am one of your hosts, Shay Robinson, and we're in the studio just hanging out. Remember, you can always follow us and watch us live at Hearts and Hills, the number one on Facebook, Instagram, and Twitter. So make sure you follow us, make sure you go out and watch our videos. But we thank you for coming in each and every night, each and every week with us at 6 p.m. every week. Hey Yolanda, how are you?
I'm wonderful, Shay. How are you?
I'm doing well.
We are in for a nice treat tonight. We are celebrating, or should I say, not celebrating, but recognizing the month of July, which is Mental Health Awareness Month. And we're recognizing that, and we have several beautiful, very well knowledge women in our studio tonight to give us information and to bring awareness of mental health. And I think that this is an extraordinary time. We're still in the midst of the pandemic. A lot of us have gotten, I want to say, relaxed and not wearing our masks because we have been, majority of us have been vaccinated. And even through the pandemic, we have experienced a great deal of loss, our family members. And and I think that as experts, that they would bring some information that is much needed at a time as this. And so to my right, I have Ms. Shirley Carlisle, and she is with the National Minority Mental Health Awareness. Did I say that right, Ms. Carlisle?
I'm with Montgomery Area Mental Health Authority.
Okay,
That's
okay, because I was trying to read my paper here.
Right, that's okay. That's okay.
And so
mental health awareness is good.
Yes, and so we just say thank you for coming on and sharing your knowledge with our community and with us.
Thank you.
And so, how long have you been with this organization?
I have been with Montgomery Area Mental Health Authority this month. It'll be 26 years.
Oh my gosh.
Yes, 26 years with Montgomery Area Mental Health Authority, which is a not-for-profit mental health center located here in Montgomery. We serve surrounding counties, Otago, Elmore, and Lowndes County, and we provide services to adults and children and adolescents. We provide psychiatric, medication, individual therapy. So we provide a host array of services in Montgomery. So we're just happy to recognize and make the community aware that we're there and that we provide the services. And if you have someone that you know or you're suffering from mental illness yourself, I say to you, don't suffer in silence.
And that's a good point, not to suffer in silence. And I'm pretty sure that probably during the pandemic or because it's still going on, I think we have this mental block and saying during the pandemic as if though it's not over. But what are some data? What are some statistics that you've received since the pandemic? Since we'll say since 2000, because it would have hit March 2000. Right. What are some inclines rise that you've seen?
Well, research tells us about 18% of individuals have suffer with a mental illness. About 4% of those are adults with serious mental illness.
Mm-hmm.
Because mental illness, everybody don't suffer with a serious mental illness, but still it can impact your life. Mental health is when you have a deficit with your negative deficit with your thoughts, your moods, your behavior. So, not everyone is considered serious mental illness, but mental illness, period, is something that you need to be aware of and get assistance and help with from a professional.
And we talk about you serious mental illness, and then you mention that there are some cases that are not considered serious. Can you give us a breakdown or a definition of what we talk about when we speak of mental illness, and then you mention serious cases?
Mm-hmm. Well, every day we suffer with, all of us suffer with some form of depression or anxiety for some reason.
Mm-hmm.
But everybody, this is not ongoing for everyone. You can, suffer with that anxiety and depression today and get some assistance or get some medicine, and you're okay. But serious mental illness, when it's ongoing, the behaviors are ongoing, the symptoms are ongoing, where you gotta live with this the rest of your life. It's serious. It's psychosis. It's schizophrenia. It's bipolar disorder. It's not your everyday mental illness, depression, or anxiety that you know where you are, you know what you do, and why you're doing it, and how you can come out of it. Well, when you got a serious mental illness, it takes time and it takes medication. It takes education. It takes a psychiatrist and other professionals to help you through that mental illness, and family members, which plays a huge role in, when you're being treated and have been diagnosed with a serious mental illness.
Ms. Carlisle, I have a quick question. Has anxiety and depression risen since COVID? Like,
Right.
have you seen more cases of that? And when I say anxiety and depression, I'm talking about a full and anxiousness and people having serious bouts of depression. Do we have more of that now? I'm sorry, I don't think she was able to hear me. But one of my questions is: has anxiety and depression increased since COVID has happened? Like, have you seen more cases of it?
We have, absolutely, it has increased. I mean, this is something that no one really knows what to do with, and when you start isolating people, remaining in their homes, not getting out socializing, it causes you to be anxious and not knowing what the next day is going to be like. Some of the anxiety comes from not knowing who has, contracted COVID-19, or who hasn't, and everybody was not complying with the rules,
Right.
that sort of thing. So yes, it has increased with adults and children. I mean, children need to be out and about, socializing,
Right.
with their friends, and that is not happening. It wasn't happening during, especially the critical times of COVID-19. So yes, it has increased. And one of the things that we done with mental health authorities, that we partner with what we call Alabama Part Together, which was a FEMA grant that served those individuals, any individual who was having some impact, negative impact about COVID-19, due to COVID-19. So certainly that it has increased our anxiety and depression and not knowing what's the next step with COVID-19 in our communities.
Yes. So before I interrupted you, you were talking about the different types of depression. Before I interrupted you, you were talking about the different types of diagnosis. So you said that there you have some major diagnosis, some serious diagnosis, and those that are not as severe. So could you share more information about those?
Sure. Everyone is going to experience some level of anxiety and depression throughout life, every day. So, those are symptoms in depression, that you know where you are, you know what you're doing, you know what you need to do. With our serious mental illness, these are symptoms that the consumer or the client does not have really control of. They're hearing things, they're seeing things, they're afraid, they're smelling things that not there. So these are the illness that are ongoing.
Right.
Once they're ongoing, and you're gonna need medication, education, and treatment the rest of your life, because mental illness, there's no cure. You can recover, but there's no cure. So those illness where you have ongoing medication, education, therapy, once a month, twice a month throughout your life, and it has impacted your work, your social life, you as a citizen in the community, then that is called a serious mental illness.
Now, I know one of the themes, just for those who don't know, July is the BB Moore Campbell National Minority Mental Health Awareness Month. This month has been set aside so we can talk about mental health in minority communities. And the theme for this year is strength in the communities. And I just want to ask you, Ms. Carlisle, you're in this every day, engulfed in it, and you're seeing the cases. Tell me more about how is mental health impacting our communities?
Well, for our minority community, since this is Minority Mental Health Month, let's talk about that just a bit.
Okay.
For generations and generations, our minority community has suffered with mental illness, not just mental illness, but health problems. They didn't have access to health care. So what has happened with COVID-19 is just exacerbated the problem, because in those, not having access to the vaccines, having health problems. And we're as minorities, we're the ones that mostly have the diabetes, the lung disease, the heart disease. So couple that with, COVID-19, so we don't have the vaccine. We don't know exactly the facts about what the COVID-19 will do to us. So we'll continue to socialize. We'll continue to not get that health care. We'll continue to not have access to the vaccines. And those that had access made sure that some of our minority community didn't gain access to the vaccine. So that just exacerbated the problem. So, and then on top of that, we continue to social gather. In our minorities community, you all know we're all about families. We're all about getting together. And with COVID-19 spreading, and as it was, and not having the vaccine, not having access to it, our minority communities, they suffer more than any other community. So yes, COVID-19, coupled with not having health insurance, not getting access to medical care. Yes, that really caused some issues in our minority community, and still causing those issues for those communities who still does not have access.
Ms. Carlisle, how do you think that we can get the word out to those in the community to get vaccinated? Or do you think that the health professionals can come to the communities to bring that? I know we've done several things. I know some churches have had several medical booths set up for that. What is something that we could do, be proactive in getting our Black people, our minority communities vaccinated, or be aware?
Right. Well, it just like with children, they say it takes a village.
Yes, ma'am.
It takes a village with this as well. It takes a village. We have to just not just the medical professional, but anyone in our community. Our political leaders, our medical professionals, our mental health professionals, and just the community as a whole need to go out and provide the facts. Provide the facts. You all already know that many years ago with the Tuskegee experiment, we are reluctant to take any kind of injection, and that because of the racism that we've endured, that because of the discrimination we've endured. And so our minority communities are already fearful of government and medical professionals. Let's call it what it is now. They're already fearful of that. So certainly we can go out, spread the word, and we're doing that. I've seen many other communities that are going out, spreading the words. And these are not medical professionals. These are just individuals who want to make sure that us as a minority get that same service, get that same vaccine that everyone else is getting, and to save lives and not spread it to our family members or have that to worry about. So sure, we're going to have to do what we do with children. It takes a village to get this done.
Thank you so much, Ms. Carlisle. Now, I do want to state this fact. It says that 44 million, and this is from the Mental Health America website, 44 million of adults deal with mental illness. That is a lot of people, and this is just for U.S., 44 million people. Stay tuned. We got some more Hearts and Heels. I have a question. We have a viewer who has posted a question. So when we come back from the break, we're going to still be talking to Miss Shirley Carlisle. She is here sharing with us about mental health awareness. Stay tuned. You listen to Hearts and Heels. We'll be right back. So you guys stay tuned. We're going to get another member in, and we'll be right back on. You did well. Thank you. I'm
sorry.
This one.
I'm trying to get you straight.
Yes. Yes, that you guys still on this a while. Hi, Erica. All right. So we'll be on in just a second. We're ready. We're ready whenever.
You have your headphones on the side.
So make sure these headphones are working first.
Okay.
You
As
can
he
hear now?
gets ready to get the headphones together, thank you so much, Mateus. I can't pronounce your last name. I'm just going to say Mateus. We're going to share your question with our health professional so we can get your answer. Give us just a moment.
We both know I'm not smart.
I know, right? They can hear you. So we have a
Okay, you're gonna have to put yours back in. Yep. It's still
we know all that technical difficulties happen at all
Somebody's headphones
times.
just fell off.
Can you believe
Okay,
that
just
44 million people are dealing with mental illness in all these different ways? Ooh. Depression, 17.3 million.
yeah, it's up.
Youth with severe depression, 9%. Percent of young people, 13 plus, with PTSD, 5.7%. It's a lot.
Miss Carlisle, you think you're good, right? You're good.
Percent of U.S. adults with schizophrenia. A lot of statistics.
All right.
And we're good to go. So we're going to get ready to get started.
Yeah, right after this break.
Can you post that for me? Yep. We're coming back from a break. We haven't been taking breaks in a long time, but we are taking a break, a commercial break on the radio. So you're watching behind the scenes. Well, our people in radio land just getting ready for us to talk. And welcome back to Hearts and Heels. Thank you so much for joining us. You are hanging with Shay and Yolanda. We have some special guests tonight that's talking about mental health awareness as we celebrate July mental health awareness for minorities. And we're just discussing of quite a few things. If you hadn't been with us, make sure you go watch us live on Facebook and Instagram and Twitter, all those places at Hearts and Heels, the #1. Now we have Miss Carlisle and Miss Erica Barnett. Hello, Erica. How are you?
Hey, I'm doing good. How are you?
You're doing well. We're doing well. You got to talk in the mic. Now we had a question while Miss Barnett was sharing, while Miss Carlisle was sharing earlier, and this is the question that we have. It says, "Did I do the right thing? My depressed friend 2 weeks ago told me that it's better for us to stop talking and asked me to stop texting her because she thinks she's toxic. After that, I told her I don't find her toxic and that I'm grateful for having her in my life. I went a week without talking with her at all. Then I talked to her at the gym as if nothing happened. Then I texted her saying I was thinking of her since I hadn't seen her at the gym anymore. She replied to me normally. Was it the depression clouding her mind when she asked me not to talk to her again?" That was Yes.
Yes, most of the time and we see this often, actually too often,
Mm-hmm.
where a lot of individuals become depressed. And I think the first symptom of depression is they try to isolate. You begin to isolate yourself from your loved ones. You know, a lot of times as parents, those are some signs when your children are isolated in their rooms, or when you have a friend who you usually hang out with a lot, or you talk to a lot, and they stop answering your phone calls, they stop answering your text messages, they don't want to go out with you as much. Those are definitely symptoms of depression. Absolutely.
So how would someone respond once they see that symptom? Would they keep, I guess, pursuing them? Would they keep engaging them, or do they need to report them? What are some ways that, as a community, as we think about this from a community perspective, what are some ways that we can reach that person who may be trying to isolate because of depression?
I think it's absolutely important, especially in the time that we're in now,
Mm-hmm.
with COVID-19 and everything going on. You know, we've been isolated, for so long anyway. But
Yes.
outside of COVID-19, it's important to be involved with our loved ones, with our friends, being aware of them, knowing, when being able to recognize when something is going on with them. And if you see something different that they don't usually go through, it's important to bring them back in, to let them know that they're loved, let them know that you're involved, that you do care about them. Just like the young lady said, she kept texting, she kept encouraging her, she kept trying to talk to her and stay in communication with her. And so it's particularly important to don't allow a person who you feel or suspect is depressed to stay into that little place. It's important to pull them out, to encourage them, to speak to loved ones around them, and let them know and talk to them if you notice anything going on with them. And especially if you see the behavior starts to worsen, if they're isolated more, if they're talking about different things such as being hopeless and not wanting to live and not want to continue, they'll start to throw things out there. If you notice that, that means it's getting a lot more severe, and you need to actually bring in a professional at that point.
That's a good point to bring up. And that was Erica speaking just now. What are some types of mental health issues, other than the one we just talked about, that you see on a daily basis? What are some other issues that you see?
A lot that we see in mental health, we deal with a lot of schizophrenia. We deal with a lot of bipolar. We have a lot of, and those are things to notice, symptoms in your loved ones and friends as well. And bipolar, if you have the severe mood swings, if you have the severe the highs and then the lows, if you notice those going on, if you see, as far as their behavior change and their thought processes change, and a lot of time they'll have a lot of loose association with certain things that are going on. They'll begin to talk, and sometimes you even have hallucinations, or a lot of those symptoms that go on that we see on an everyday basis at mental health. Ms. Carla has seen years, over her time, 26 years, she's seen numerous situations where, and these are the behaviors that we see on a daily basis. And as mental health professionals, what we do is we encourage our consumers those that are prescribed medication, they take their medication, they talk to their therapist, and they're able to manage the behaviors. Sometimes the behaviors don't completely go away, but they're able to manage them and be able to function on a daily basis, because our goal is to get our consumers to be able to function on a daily basis.
Right.
We have many consumers who, they hold jobs, they have families, they have children, they function. And so as mental health professionals, those that are on medication, we provide them that. Those that have therapy, we just help them cope on a daily basis. And as Ms. Carlisle stated before, all of us have been in a situation where we need, it may not be a severe mental illness, but we have light situations where we have depression and different things going on. They may not require medication, but we need someone to talk to, or we need someone to be able to vent and just get it off of our chest and be able to function.
Most of those mental health, like, I'm just tired.
Yeah.
Because I know, like, I've heard some of my friends say, I'm just tired.
Yeah.
And then I would say, what do you mean?
Mm-hmm.
Because that's something.
Yes.
I think that's something not to be ignored.
Right.
And so what are some, you mentioned schizophrenic.
Mm-hmm.
I think I said that correctly. Excuse me. And I wanted to know, what are some of those signs and symptoms like? I know I have a friend, a childhood friend that is. Excuse me.
Mm-hmm.
And I wanted to know, what are some of those signs and symptoms?
Yeah.
Yes, that's fine. Some of the signs and symptoms for schizophrenia is that seeing things that's not there,
Mhm.
smelling stuff that's not there, psychotic behavior.
Mhm.
Not all of our mental illness clients are aggressive or become verbally aggressive or physically aggressive, but when you're talking about schizophrenia, you're talking about some behaviors that they can only recognize that are there and no one else can see or know that those behaviors are there, and they acting out those behaviors. They're completely acting them out. They become angry, they become aggressive, or they see things that not there, or they
Mhm.
think that you're putting something in their food and they
Mhm.
won't eat it. So all of these are signs and symptoms of serious mental illness such as schizophrenia.
Do you, and this may be a far stretch for me to ask this question, but do you think some of those mental health issues are kind of cultural norms?
Well, what we've done over the generations is that we, as a minority group, we thought they were just culture norms, and some of them are. Our culture. Like for us as minority, what is said in our home stays in our home. The way we act in our home stays in our home. So we don't
Right.
share that, and we're reluctant to go out and reach out. Already with reluctant to deal with the government and the white race or medical professionals that are not like us. So we're reaching out and we're staying in and we're not telling anyone.
Right.
As you know, our pastor for many years has been our mental health professional.
Right.
I mean, that's who has pastored. That's who has treated us for our mental illness is our
Right.
pastor. Because at a certain point in time, we know that we always trusted pastors and we know that they're not supposed to be telling our business.
That's right.
Because God looking over us when he does that. But and for the black males, minority males, what they see it as is being weak.
Mhm.
So
Mhm.
no male wants to be seen as being weak. So
Mhm.
they won't reach out to get that mental health treatment. Depression is so obvious there, but they won't go out and get that treatment because no man wants anyone to think that they're weak. And the
Mhm.
stigma has been there. Remember now, back in the day when minorities, we thought when someone acted strange, they had demons in them.
Mhm.
Right.
They were demons, and we were afraid of them.
Yeah.
For even coming around us, and they were crazy. Well, that prevented us. It's still today in some of our communities that prevent us. The stigma is still there. So a lot of us will not reach out to get that help. We will go to that pastor or that minister, regardless, and try to get
Prayer.
for prayer. Religiologists, it comes a lot with the mental illness. So we have to know that, and like I tell our consumers, don't suffer in silence. I
That's
say
right.
that often
That's right.
because you got to reach out. If you have diabetes, if you have lung disease, if you have access to that medical care, you're going to be treated.
Right.
It's the same thing with mental illness.
That's right.
It's the same thing. But we have to get our community to believe that as well. Our political leaders, the top, the government, they got to be putting out that information, that education, to say it's okay to get help for your mental illness. It's okay
Mhm.
that you have a mental illness, that it is not something that's going to prevent you, because the goal is to recover from mental illness and become a productive citizen in the community again. So,
Thank
so
you, Miss Carlisle. That was amazing because you shed a light on a lot of things. I just want to ask you. So you have been dealing with this for a long time. So have you seen the progression of minorities moving towards getting assistance, or still just moving away from it?
we've done better over the years. At Montgomery Mental Health Authority, I think probably over 60-70% of our clientele is minorities right now. And if I had to guess, probably mostly women. But it's minorities. So we're moving in the right direction, but we still have communities in which I say it takes a village. We still have those communities where those individuals will not, even tell you that they have a problem. Men are depressed just like women, but men get angry instead of going get mental health. They get angry. Women go get treatment. So, yes, women go get treatment. So, yes, we've made some progress, but we still have a long way to go. And a lot of that is going to be dealing with the education. You got to educate individuals that this whole community, these cities, anywhere, that it's okay. mental illness does not mean that you shun or should be shunned in community, or
Right.
you should be a disgrace and be locked in the closet again. We don't come out of that stage. So mental illness is we made progress, but we still have a long way to go when it comes to minority communities.
Well, Ms. Barnett, I have a question for you. By the way, Ms. Barnett is the Director of Residential Service over at Mental Health. I forgot the last part.
Authority. That's okay. It's long.
Yes.
Mental health
Sorry.
is good.
I did have it written down. But I want to ask you, what are some of the things that you with this month really focusing on community and mental health? What are some of the ways that your office you're able to help people? What are some of the services that you offer at your facility?
Okay, so under residential services is actually a huge program. What we do in residential services is that we ensure that those who are suffering from severe mental illness, that they have housing. And that housing can include either we have group home setting, we assess consumers who have serious mental illness and who will be seen by Montgomery Area Mental Health to see if they qualify for a group home setting, just depend on their level of functioning. If they're able to administer their own medication, cook their own meals, and do their own shopping and personal things, they may qualify for one of our houses in the community. We have, up under residential services, we have what's called the Supported Housing Program that's funded through HUD, and the criteria for that is homelessness. Now, it's not as easy to get into as some of the other programs because there's a strict criteria of so many years that you have to be chronically homeless. There's a criteria if you are at risk of being homeless as well. And so we just assess the consumer and we look at their history, if they've been in shelters, if they've been living from bed to bed, house to house, if they haven't had adequate housing, or if they live in a type of housing where it's not adequate for living, which means they may not have power, they may not have running water, they may not have, the ceiling may not be in the right condition. So we make sure that they're living in a safe environment. So we assess, we get referrals, in-house referrals, we get referrals from the community. We have a relationship with the local shelters and organizations, Sunshine Center and different places that we have a relationship with. We get referrals, and so we assess the consumers, and those we either determine if they qualify for our program. We put them in if they need 24-hour supervision. We have homes in Otago, Lowndes, Elmore County areas where they have 24-hour supervision. We have mental health techs there who make sure that they teach them basic living skills, because our goal is to get them out if they're able to live independently. And so the mental health techs teach them basic living skills. They cook the meals for them. They assist them in washing and folding and but just basic living skills. They talk to them about money management type of things within the group home. And usually we also have a day treatment program, but that's kind of not in place right now because of COVID. So hopefully when everything clears, we'll be able to do that as well. But mental health offers a variety of different programs. We have, we do individual group therapy. We have, like I said, normally we have the adult day treatment. We have a full pediatric service where we offer counseling and therapy for children. So mental health offers an array of things.
We may have someone who's listening who may know someone who needs services. How can they get in contact with you? Can you give us the information so they can get in contact?
Yes, the first step is to contact us. We're actually located on Upperwood 2140 Upperwood Tonka Road. But if you are seeking some type of treatment or counseling or want to be calling for intake, you can call the numbers 334-279-7830.
Thank you, Erica. Thank you.
So as we get to this part of the discussion, just in case you're joining us, we have Ms. Carlisle that is on with us, and we have Ms. Barnett who's on with us from the Mental Health Authority here in Montgomery, Alabama. So we talked about some cases earlier. We talked about a few things that we can look out for. If you would share some advice that you can give to someone who maybe, or not some advice, some things that people can do, if they're feeling depressed, if they're feeling anxious, because as you stated earlier, we are at a place where we all are feeling a little bit anxious. We all may be a little bit depressed because we've been in isolation. We're trying to get used to things. For those of us who had to deal with all these kids, all these months, it's a lot of things that we're dealing with. So if you would just share some things that, or share some ways that we can deal with some of our anxiety and depression.
Well, I'll say this. First of all, if you have ongoing depression or anxiety, you need to reach out to a professional. Again, I always say don't suffer in silence. And we provide the services, psychiatric service, medication services. And coming to Montgomery soon is our diversion center. And that's going to be a community collaboration with the hospital, the jails, the sheriff department. Our executive director is Miss Donna Leslie, who worked hard to get this with the local legislators and the Department of Mental Health and the governor to get this particular diversion center open. We'll be out on Carmichael Road. We're going to serve more individuals. We're going to have what they call a temporary observation. You can come there for 23 hours. We'll assess you. We determine what your needs are. And then we will link you to what services you need.
What age group do you service again?
We're going to do adults. We start from 19 and older. Now, for us children, we will do evaluations in there. They just won't reside in that facility. We also have on the other side of that facility what we call extended observation. That would be a 16-bed, 7-day crisis unit. This is for our community. This is needed. We need more services. We need more group homes. We need more apartments. But this is a big deal for us to be able to bring people in right then and there to assess them, which keeps them out of the jails. It keeps them out of the hospital emergency room, which is tying up healthcare beds, So this is going to be a big deal for us. We're excited about this. This service should come online December the 1st. Want the community to know it's going to serve 4 counties, Montgomery, Otago, Lowndes, that's our catchment area, in Elmore. So please be aware of that. You will hear more information coming soon to you about our diversion center. But if you have any kind of, whether it's mild depression, whether it's temporary depression, pick up the phone and call us at 334-279-7830 and get help. It's there. If you want it, it's there. We take insurances. We take Blue Cross, Blue Shield, PHIP, and we also do fee waiver. If you're, some of your fees are going to be based on your income. You don't have income, we work with you.
Okay.
Because the goal is to help stabilize and treat as many people possible in this community.
And part of that also, do you service people who may have PTSD as well?
Absolutely.
We didn't mention that.
Absolutely. That is one of the diagnoses that you'll see often with some of our clients is PTSD, schizophrenia, bipolar disorder, schizoaffective disorder, major depression, clinical depression. Those are the diagnoses that we serve quite often.
Which one is more prevalent, has been on an increase?
Schizophrenia.
Okay.
Schizophrenia has been on an increase. You'll find that a lot in the males and females. Most of the males are going to be with the depression, but we're seeing an increase in schizophrenia. We're seeing an increase in depression and anxiety due to COVID-19 anyway. So we have partnered with, as I said, Alabama Part Together, where we set up crisis counselors to be able to reach out, have the individual to call us, anyone. Didn't matter, because COVID-19 affected all of us about the same. So, if you had some issues with that, if you had a loved one to die, we provided that grief counseling there. We link you with, if your electric was off due to not working, we link you with those services to sort of help you through this depressed time, because it's a depressed time for us when we're dealing with COVID-19.
So you're like a one-stop shop.
All the way there. We're a one-stop shop.
I mean, that's amazing to hear. I didn't know any of this, so this is great that you're sharing this with us. Now, as part of the healing or getting over depression and anxiety and schizophrenia, I want to talk about, drugs and mental health. Mm-hmm. I know over the years it's been a lot of, a lot of talk for both some natural healing things and of course spiritual healing things, and then drugs. Could you just talk about that a little bit more, just to clarify, maybe the separations between the three rather?
Yeah. What usually you'll find with our clientele is that co-occurring disorder, and that normally will come from people not getting the mental health treatment, so they try to treat themselves. You know how we
Right.
go over the counter to get that
Yes.
medication.
Yes.
They try to treat themselves. So what they result in is alcohol and drugs. To try to get rid of the voices, to try to keep the mood down, to try to prevent from being so depressed. So you will find that often that's what they do. And instead of our minority communities, we have other, races, that's the same thing. But you'll find that we use those kinds of things to help us cope with mental illness instead of seeking treatment, professional help.
Yeah, I know one of the major things that's been happening, of course, across the world is the opioid crisis. Could you just share more? I just want to know your thoughts about that. How has that impacted minority communities?
Oh, absolutely. Again, that's how we're coping. That's how we're coping. We're coping with getting high or drinking so we won't have to face the day-to-day issues that we're facing every day. So that becomes a serious problem. It becomes an addiction, with mental health and with the substance abuse. I did not mention it, but I am going to because we have now started a substance abuse program at Mental Health Authority. So you're right, we're going to be a one-stop shop because we're now providing that. Because what we're seeing when our clients, we provide services from 4 different counties, about 5,000 clients. But what we're seeing is that an increase of those co-occurring, those dual diagnoses.
Right.
We see the substance abuse and we see the schizophrenia, the bipolar. We see the mental health issues as well.
So would you say, and I know, so this is only her opinion for everybody out there, Mrs. Carlisle, Ms. Barnett. Would you say that the number one reason people are not getting help is just they don't want to acknowledge that they need help?
That's probably not the number one reason for our minority group. Number one reason is that we don't trust. We don't trust, and we don't have all the facts, So, but yes, that is one of the reasons, but is not the ultimate goal why we don't get help from our minority communities. It's because we don't have the facts, we don't trust, we don't have access. You got to give us access to what we need.
And I think you mentioned that earlier when you made a comment about why we're not going out and taking the vaccine, because we don't trust what the government is saying.
That's exactly
and
right.
So, and that kind of, that goes hand in hand. So if I don't trust what the government say, then I'm not going to trust, my health to you and let you in on some things that I'm doing.
Right.
So I think that goes hand in hand.
Right. That's exactly right.
Now, you guys have been amazing. Thank you so much. I do want you to share again as we get ready to close out this segment. You guys got to stay tuned, though, out there in radio land and social media land, because we have some ladies that's coming up to share about opportunities in mental health. But if you would, please share numbers, ways that they can get in contact with you if they feel like, I may need this mental health. I may need some assistance. If you could share that information one more time.
Okay. Ms. Barnett mentioned that we are located in Montgomery at 2140 Upper Wetumpka Road. If you need services, you can call 334-279-7830, 8 to 5, Monday through Friday. After hours, you can call that. We have an emergency service that you still got contact with mental health professionals after hours. So you can call that same number, 334-279-7830. The emergency services will pick up and then connect you with a mental health therapist. So we still have that services throughout 24/7.
And as you get ready to leave, Ms. Carlisle, Ms. Barnett, would you mind just sharing some encouragement to those who are out there? Any type of encouragement just about mental health, whatever you want to share, just to encourage those to come in, get some help, or to encourage them through their hard time.
For me, I would say just know that mental health does not discriminate. Mental illness does not discriminate. Anyone at any point in time, either one of us could, tomorrow, be suffering from a mental illness that we have to seek professional help. So do not suffer in silence. It's okay. It's okay. So know that it's okay. The stigma is out there, but it's not going to outweigh what you're going to need when you need that treatment for mental health. So come in, call us. It's okay. Everything we do is confidential. You don't give us permission to share it, we won't share it. So give us a call. Come in. know that we're there. The services are there. All you have to do is reach out.
Thank you. Thank you, Ms. Carlisle, and also Ms. Barnett for coming on.
Well, stay tuned. We are talking about tonight mental health awareness, because this month we're celebrating for minority mental health awareness. We have had Ms. Carlisle, Ms. Barnett on here from the Mental Health Authority here in Montgomery, Alabama. They provided information on how to get in contact with them. Stay tuned. After these messages, we're going to have more people in to share about Mental Health Authority, but this time it's about job fairs and some careers as we talk about mental health careers and you're in ways that you, if you need a job, if you know someone who need a job, go grab them, tell them to come on and take a listen. We'll be right back. You're listening to Shay and Yolanda on Hearts and Heels. All right, we're switching up, guys, so stay tuned. Don't hold it to us. We'll be right back. Oh, it's fine. Just tell them hey.
Hey, so glad to be here.
Don't leave though.
Okay, don't leave.
Hang out so we can talk. I'm gonna talk to her. And then she called me out with my little wrist off.
Your dress cute. You're gorgeous. You were gorgeous. Don't you worry about doing it.
Yes, ma'am. Okay, I will listen to you now. Yeah. I know. That's the director, right? Is she the director?
Yes.
Yeah. Yeah, she did great.
She awesome.
Yes.
Yes, I'm gonna go in. You can have
Yeah.
a seat right
Yes,
there
ma'am.
and put the headphones on.
I love the way you did it though.
Listen, we're talking about jobs
What?
in just a few moments. So go get someone and they need a job. Tell them it is time for them to listen. It is going down here.
Yeah. Right.
Yes, sir.
Job opportunities, job
The
opportunities.
headphones?
Put this on. Okay.
Yes, ma'am.
Make sure you can hear. Shay, say something in the mic so we can make sure.
Hello, testing 1, 2, 3.
Oh,
All right.
This
so,
is going to be the fun part where we learn about careers and job
Shay.
opportunities.
Say
Thank
Shay.
you, sir.
no
Shay.
problem.
Say recognize. Say recognize.
Okay, gotcha.
You can hear it too.
Please. Thank you. Please and thank you. So
So we'll be back on in just a minute as we close out the hour. You guys got the good information. Y'all ready to share?
you've been doing this for a long time.
Pretty much, but this is the first time we did something like this there.
Okay.
All
Are
right,
y'all good?
Yeah, we're ready.
Put your notes on top of my notes.
I'm sorry.
Can you you're okay?
I can
Miss
hear
Jill McCord.
Yes, ma'am.
Okay. And Miss Josephine Carroll.
correct.
Okay. Let's make it sure.
Thank you.
Yes, ma'am.
So it's not.
I'm going to ask Miss Carroll all the tough questions.
Okay.
If you would, when you speak, just bring the mic a little bit towards you so we
Yes,
can
ma'am.
make sure they pick up your voices. All right, we're getting ready to come back on the air. I hope you got someone or you shared this with someone who's looking for a job opportunity. We're headed back on in 5, 4, 3, 2. No, I was just doing my own countdown.
Really, Shay?
sorry, guys.
We're so glad that y'all tune in though. Are there any questions that's going on right now,
Yes,
Shay?
and welcome back. Okay. Welcome back to Hearts and Heels. Thank you so much. You've been listening to Shay and Yolanda. We've been talking to mental health awareness with a whole team of mental health awareness. And we've had Ms. Carlisle on the whole hour, and most of the hour, and Ms. Barnett. They've shared with her. Ms. Carlisle's the director, and Ms. Barnett's the director of residential services. Now we have with us Ms. Josephine Carroll and Ms. Jill McCord. They are both in HR. That's human resources. You know, that's our favorite, but our most hated department. Just kidding. As we celebrate or as we recognize minority mental health awareness this month, we do want to shed light on mental health and job opportunities. Now, Mrs. Carroll, how are you doing tonight?
Just fine.
Thank you so much for joining us. I know that you have a career fair that you want to share with us and talk about it just a little bit, but I want to ask you this question. How 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 many minorities are engaged in minority health in the way of being the practitioners? How often do you see us represented, minorities represented in the field of mental health?
We are greatly represented in the field of mental health by minorities. I would say at least 1/3 of our staff are minorities, with the psychiatrists and providers for the Montgomery Mental Health Authority.
Okay, so but we got to get some more people engaged, right?
Yes, ma'am. We are so excited about having our first on-site job fair, which will take place July 22nd from 9 to 2 p.m. on site at 2140 Upper Wetumpka Road, Montgomery, Alabama. We are looking for great people that would like to work with us and have great benefits. If you feel like you can meet those standards, we would be glad to have you. Please attend the job site, bring your resume. We will be interviewing on site, so we ask that you bring all the information. We will be wearing masks, so we will be protected during the COVID.
Now, what time is that?
The time that the
Job
job
fair.
fair will be from Thursday, July 22nd, from 9 to 2 p.m.
Wow, that's amazing. What type of positions are you looking for?
The type of positions that we are currently looking for are mental health tech positions, residential home coordinators, accountants, office managers, employment specialists, case managers, crisis support specialists, facility and groundkeepers, HR specialists, RN, LPN, medical assistants, therapists, and peer support staff.
Wow, that's a wide range of people that you're looking for. Now, again, in case you missed it, July 22nd, Mental Health Authority is having a job fair, and there will be on-site interviews. They want you to bring your resume, come prepared, be dressed up, put on your suit pants and your suit shirts and your nice dresses, ladies, and meet them at 2140 Upper Wetumpka Road, Montgomery, Alabama. What are the types of what type of background are you looking for? Like, are there special education? I know for the psychiatrists, those they have to have certain degrees, but what is the education requirement for the positions that you're looking for?
Most of our therapist position will have to have a master's degree.
Okay.
Case managers would have to have a bachelor's degree in psychology or social work field. The unit secretary's position, we ask that you do have a diploma or GED.
Is there a website that they can go to and get this information?
Yes, ma'am. Our website is www.mamha.org.
Now, you also said you're looking for some HR specialists. So we got
Yes.
the HR director on here looking for HR specialists. Why don't you tell them what you're looking for?
I'm looking for a HR specialist that's confidential, customer friendly, knowledgeable, and oriented to serving the staff and the companies that we work for.
Now, Miss McCord, you've been quiet over there all night, so I have a question. Tell us what is the culture of the Mental Health Authority? What is the culture, and what should potential employees expect?
Well, I'm fairly new. I'm going on my third year there, and it is a friendly culture, and it's all about helping the consumer. Everything that we do is about helping the consumers.
Okay, will you be on site also?
Yes, ma'am, I will.
Now, are you with HR as well?
Yes, ma'am.
And what type of services do you provide with the HR department?
What is my job specifically?
Yes, ma'am.
I schedule interviews. I do all types of the paperwork and onboarding for employees who are being hired.
And will you be at the job fair as well?
Yes, ma'am.
Okay.
Yes, I mean, so listen, guys, the job fair is July 22nd from 9 to 2 p.m. And I'm sorry, one more time, Miss Carol, will you please share with us the positions that you have available?
Certainly, the positions that are available currently are residential home coordinators.
Residential home coordinator. And what are the educational requirements or experience requirements for that position?
We would like that position. That position requires you to have a bachelor's degree and at least 2 years experience in that field of mental health.
Okay.
And the mental health tech positions, they require high school diploma or GED. Accountant, we require a CPA and a bachelor's degree. Office managers require high school or GED. Employment specialist requires a bachelor's degree. Case managers also requires bachelor's degree. Crisis support specialist requires a bachelor's degree. We also have maintenance and groundkeeping, which requires only experience in a high school diploma with or a GED equivalent.
Okay, so I have a quick question for you. You said for them to bring a resume, and now do they need to schedule an appointment, or do they just show up any time during that time
They
period?
can show up during the time or between the time 9 and 2 p.m. and we will direct them if they want to be interviewed on site and be offered a position.
Okay, and you told them www.mamha.org, and they can get information about the job opportunities.
Certainly.
Is there anything else you would like to share, either one of you, Ms. McCord or Ms. Carroll, about working with the mental health culture? Is there anything? Would you like to share something to draw the people to come out and for the job fair?
Yes, we provide a type of service that gives people encouraging hope that they are worthy. They can be productive individuals in the community and they can give something back.
I love it. They can give something back. So if you want to do some service, let me ask you, do you have volunteer opportunities in case someone just want to come volunteer at some certain times?
Right now, we do offer volunteering services, but during the COVID-19, we are asking that we have that on hold right now.
Gotcha. I know COVID's messed a lot of things up, but it's also given us a lot of opportunity to sit back. We thank you so much for joining us tonight, ladies. It's been a wonderful time sharing with you. Again, that job fair, the career fair is July 22nd from 9 to 2 p.m. at 2140 Upper Wetumpka Road in Montgomery, Alabama. If you have questions, if you want to know more about the positions and the information surrounding the positions, it's www.mamha.org. Make sure you show up on the 22nd. Show up with your resume.
At
show
8
up
o'clock, not at 9, but at 8.
Make sure you show up with your nice clothes on, and make sure you have everything, all your hair put together, and go in there represent. And they will be interviewing on the spot, so there are opportunities for you to get a job there immediately. They're looking for an HR specialist. They're looking for case managers. They're looking for residential case workers, and they're looking for facilities management. I tried to remember it all.
That was good, Shay.
They're looking for all
Wonderful.
of those positions, and they need your help. This is such a great opportunity to give back in service. As Ms. Carlisle has been sharing throughout the show, it's a wonderful thing to work with mental health and to serve your community in such a way where you're helping others, you're inspiring with them, and you're moving them to the next level. Thank you so much, Ms. Carroll, Ms. McCord. Do you have anything else you want to share with us? They over there smiling and talking.
No, we hope to see many people come out and join in the opportunities.
We just again like to say thank you to the department, Montgomery Area Mental Health Authority, to Ms. Shirley Carlisle, who is the clinical director, Erica Barnett, the director of residential services, Ms. Josephine Carroll, who is the human resource director, and Ms. Jill McCord, who is human resources specialist. Again, we just thank y'all for coming on and giving our listening audience some real good information, and hopefully you'll have an influx of folks that come out on to the job fair. And that is on July The 22nd. July 22nd. Be there at 8 o'clock. Now, the job fair starts at 9. Don't show up at 9. Be there at 8. So,
Yes.
but we just always want to say this before we leave the air. Just whatever you do it with all your heart. And if you can't do it with your heart, put your heel on it and walk away.
Yes. Thank you so much for joining us tonight. She look at you like, woo, child. Thank you so much for joining us tonight. We have had a great night. Really focusing on mental health and talking about mental health conditions. Make sure you watch us and make sure you come and listen to us next Thursday, 6 p.m. We'll be back here, same time, same place, but definitely not the same way. We love you guys and good night.
Good night.
Y'all were excellent.